Hey everyone, welcome back to the channel. Today we're diving deep into a shocking topic that could change how we think about PTSD treatment. It's about a drug called Prazosin, a medication often used to treat PTSD-related nightmares, insomnia, and even suicidal thoughts. For years, doctors thought it could help patients by reducing those terrifying trauma flashbacks and helping them sleep better. But a new study from 2018 is raising some serious red flags, suggesting that Prazosin might actually make nightmares and insomnia worse, and potentially even increase suicide risk. Dr. W. Vaughn McCall, the lead researcher and chairman of psychiatry at the Medical College of Georgia, calls this a game changer that demands more questions. So, what's really going on with Prazosin? Is it a lifesaver or a hidden danger? Let's break it all down. Stick around to uncover the truth. First, let's talk about what Prazosin is and why it's used for PTSD in the first place. Prazosin is actually a high blood pressure medication, but doctors have been prescribing it off-label for PTSD patients because it's thought to calm the brain's overactive stress response. If you've ever heard of the fight-or-flight reaction, that's what Prazosin targets. It blocks certain stress hormones to reduce the intensity of nightmares and insomnia. For someone with PTSD, nightmares aren't just bad dreams. They're often vivid replays of the trauma that caused their condition, like a soldier reliving a battlefield explosion, or a survivor of assault being trapped in that moment again. These nightmares can be so intense that they disrupt sleep entirely, leading to insomnia, exhaustion, and even a higher risk of suicidal thoughts. The idea behind Prazosin was simple. If you can stop the nightmares, you can help the patient sleep better, feel less anxious, and ultimately lower their suicide risk. Sounds promising, right? But here's where things get complicated. The 2018 study we're talking about today was published in the Journal of Clinical Psychopharmacology, and it involved 20 PTSD patients. These weren't just any patients, they were people dealing with severe symptoms. The group included 2 military veterans and several civilian women, many of whom had been sexually assaulted. Every single one of them had active suicidal thoughts, and some had even attempted suicide in the past. Most were already on antidepressants like Zoloft or had them prescribed as part of the study. For 8 weeks, these patients took Prazosin at bedtime, with the goal of reducing their nightmares and suicidal thoughts. Researchers checked in weekly to assess their symptoms, looking at things like the severity of suicidal ideation, nightmares, insomnia, depression, and overall PTSD symptoms. They were hoping to see some positive changes, maybe fewer nightmares, better sleep, or a drop in suicidal thoughts. But the results were not what they expected. Here's the bombshell. Prazosin didn't really help with suicidal thoughts, which was already a letdown. But what was truly shocking, Dr. McCall called it mind-blowing, was that the drug actually worsened nightmares and insomnia for many of these patients. Imagine being in their shoes. You're already haunted by trauma, barely sleeping, and now the medication that's supposed to help is making your nights even more terrifying. Some patients reported their nightmares becoming more vivid, more frequent, and harder to escape. Insomnia got worse too, leaving them even more exhausted and on edge. During the study, 2 patients got so bad that they needed emergency inpatient psychiatric care. Thankfully, there were no suicide attempts or deaths during the trial, but the fact that things escalated to that point is a huge red flag. Dr. McCall summed it up by saying, maybe it's not for everybody, and that's a big understatement. So, why might this be happening? Dr. McCall has a few theories. One possibility is that the patients in this study had particularly severe PTSD, which might have made them react differently to Prazosin. Another idea is the dosage. Prazosin was given once a day at bedtime, but maybe that wasn't the right approach for these patients. PTSD nightmares often center on the trauma itself, and Prazosin might somehow amplify those memories instead of blocking them. Think about it. If your brain is already wired to relive trauma every night, a drug that doesn't work as intended could make things worse, like turning up the volume on a horror movie you can't stop watching. To give you a sense of what this might feel like, imagine a woman named Sarah. Not a real patient, but a hypothetical example. Sarah survived a violent assault years ago, and every night, her nightmares drag her back to that moment, leaving her screaming and drenched in sweat. She starts Prazosin, hoping for relief, but instead, the nightmares get more vivid. She can hear her attacker's voice clearer than ever, and she wakes up even more terrified, unable to sleep at all. That's the kind of struggle some of these patients might have faced. So, why might this be happening? Dr. McCall has a few theories. One possibility is that the patients in this study had particularly severe PTSD, which might have made them react differently to Prazosin. Another idea is the dosage. Prazosin was given once a day at bedtime, but maybe that wasn't the right approach for these patients. PTSD nightmares often center on the trauma itself, and Prazosin might somehow amplify those memories instead of blocking them. Think about it. If your brain is already wired to relive trauma every night, a drug that doesn't work as intended could make things worse, like turning up the volume on a horror movie you can't stop watching. To give you a sense of what this might feel like, imagine a woman named Sarah, not a real patient, but a hypothetical example. Sarah survived a violent assault years ago, and every night her nightmares drag her back to that moment, leaving her screaming and drenched in sweat. She starts Prazosin, hoping for relief, but instead, the nightmares get more vivid. She can hear her attacker's voice clearer than ever, and she wakes up even more terrified, unable to sleep at all. That's the kind of struggle some of these patients might have faced. Now, this wasn't the first study on Prazosin for PTSD, which makes things even more confusing. For about 10 years, earlier research suggested Prazosin was helpful for PTSD nightmares, giving doctors a reason to prescribe it. But then a larger study in February 2018, involving active and retired military personnel, found that Prazosin had essentially no effect on nightmares or sleep quality. And now this smaller study shows it might even make things worse. Dr. McCall is scratching his head, saying, we need to reconcile how we had 10 years of data saying Prazosin is good, a big study showing no effect, and now a smaller study showing it can worsen some aspects. He's reaching out to PTSD experts across the US to get their input and figure out what this all means. Clearly, there's a lot we still don't understand about how Prazosin works or doesn't work for PTSD. What about alternatives? Right now, the only FDA-approved drugs for PTSD are antidepressants like sertraline, known as Zoloft, and paroxetine, or Paxil. But Dr. McCall points out that neither of these is widely effective for most patients. They might help with depression or anxiety, but they often don't touch the core PTSD symptoms like nightmares or hypervigilance. So where does that leave patients who are struggling? Dr. McCall warns that Prazosin might not be the best choice for PTSD patients with active suicide risks, which is a critical point. If you or someone you know is dealing with PTSD, this study suggests you should talk to your doctor about whether Prazosin is right for you, especially if suicidal thoughts are a concern. There's no one-size-fits-all solution, and this study shows how important it is to keep researching better treatments. Let's take a step back and think about the bigger picture. PTSD is a devastating condition that affects millions of people. Veterans, survivors of abuse, accident victims, and more. It's not just about nightmares or insomnia. It's about living with a brain that's stuck in survival mode, constantly reliving trauma. A drug like Prazosin was supposed to be a beacon of hope, but this study shows that hope might be misplaced for some patients. It's a reminder that mental health treatment is incredibly complex, and what works for one person might harm another. Dr. McCall's study isn't the final word on Prazosin, but it's a wake-up call that we need more research, better options, and a deeper understanding of how to help those with PTSD. This brings us to the end of today's deep dive, but I want to hear from you. What do you think about Prazosin after hearing this? Should it be reevaluated for PTSD treatment, or do you think we need entirely new approaches? Drop your thoughts in the comments below. I read every single one. If you found this video eye-opening, please hit that like button and subscribe for more health truths like this. Don't forget to ring the bell so you never miss an update. And if you're curious about other sleep disorders, check out our video on fatal insomnia right here. It's another mind-blowing topic you won't want to miss. Thanks for watching. Stay curious, stay informed, and I'll see you in the next one.